All right. We are live. Shireen from Real Talk Sales Consulting. And I've also got Miss Vanna, who is my new
Hi.
my new project manager, who quite honestly, she keeps me sane.
Nice to meet you all. So happy to see you all.
Couldn't do it without her. And so I'm excited. I'm excited about doing this live because I want to talk about something that quite honestly, my coaching clients struggle with, which is role playing. I'm hearing a little bit of an echo, but I think we'll be all right. It's gone, I think. All right. I'm just going to keep rolling with this. So when I coach, and today, in just a few moments, I'm going to play treatment coordinator, which I haven't done in a minute, but it's all good. In a few moments, I'm going to play treatment coordinator, and Vanna is going to be my patient. And we're going to role play just a very specific part of a consultation. Quite honestly, the most important part, which is actually presenting treatment and investment. This is the part that people struggle with. That's what they struggle with. And so we're going to do that. And the way I'm demonstrating this, because the real talk selling way is not having a treatment coordinator go into the consultation room in a cold fashion. I called that cold case presenting, which unfortunately, that is how a lot of dental offices are set up. The patient's there, they've been there an hour, they're exhausted, they got to use restroom, they want to get something to eat, and their mind is jumbled with tons of information. And by the time somebody goes in to present treatment, they're like, what? It becomes salesy. And that's not what real talk selling is all about. And so this is not scripted. Hey, Jackie, hey girl. Jackie, thank you for showing up. I miss you. That's one of my buddies from Clear Choice. She's a rock star, y'all. Um, I don't know what Vanna's going to be talking about. I mean, like, this has not been scripted because that is what it's all about. It can't be scripted, but you got to be able to like bounce back, roll with resistance, and all that good stuff. So I don't know what she's going to throw back at me. And Jackie could probably agree with me. The one thing I can say about being a salesperson at Clear Choice, shout out to Clear Choice, is that they always forced us to lean into our edge in training and getting better. And they weren't afraid to invest in that because being a patient consultant treatment coordinator is it's a process. And so I might be a little bit rusty, but we're going to try this. And the one thing I do know about Vanna being this patient, the only thing that I know is that she's playing herself. And Vanna, you can come off mute. I would like for you to share who you're playing. And this is all I know.
So I'm going to be playing a phobic 27-year-old patient who hasn't been to the dentist in the past 10 years.
Yeah, that's all I know. And I told Vanna I want her to throw some things out and make it difficult. Make it difficult. You never want to role play with somebody who like makes it real difficult, But how else do you get better? Role playing is what needs to be done. It's funny too. When I coach treatment coordinators and I say role play this with me, they still can't do it. What they'll do is say, well, what I would say is no. Role playing is you jump into it, and however the person responds, you got to be able to like, oh, I'm gonna go this direction, And it's okay to pause. Sometimes you got to pause to get your thoughts together. So we're just going to jump into it. Here's the setting. The doctor has just finished with Vanna. I'm a treatment coordinator, and I have to come in awkward, which this feels awkward, introduce myself, and we're going to see how this ends. You good with that, Vanna?
Yes, I'm ready.
Okay, Jackie, any suggestions for this role play? Yes or no? You want to throw any curveballs out there? Jackie's my friend, so she may not want to necessarily make this difficult. As we're role playing, if there's anything that you believe Vanna should throw out there, feel free to chime in. So I'm walking in the room, and you're sitting in the dental chair, so that's the setting. Miss Vanna, how are you doing today?
I'm okay. I just finished my visit to the dentist. I'm quite scared. I'm not sure what to expect next.
Let me introduce myself to you formally and let you know all of what you are feeling right now, it's okay. All right? It's okay. My name is Shireen, and I work with Dr. Smith. And a part of what I do is to help patients just like you, and you're not the only one, is number one, figure out what needs to be done. But then a big part of what I do is to help make treatment financially comfortable for you. Does that sound okay?
Well, that sounds reassuring. I just don't know what next steps to take. I'm not sure if I understood what the dentist mentioned earlier. He said that I needed some type of treatment. Could you explain to me what he meant earlier?
Yes, I will absolutely do that. Did you like the doctor?
Yeah, but then I just wish he could explain things a bit further because I didn't quite get what type of treatment I need.
Yes. So this is good because I don't want to go off into saying what it is and how much it's going to be, and we don't even know what it is you have to have done. I want to step back just a second. Bear with me here because I don't rush this part. You have about 30 minutes or so for me to do this so I can help you. You all right with that?
Yes, I'm fine. I'm not in a rush.
Okay. You need to use the restroom, or do I need to get you some water?
Oh, no, no, I'm good. I just, yeah,
Okay.
want to get this done and over with.
Okay. See, the doctors don't know to ask if you have to use the restroom sometimes, so I gotta
Yeah.
ask.
I appreciate
Okay. Yeah.
that.
So there's from what I gathered from the doctor, it's been a while since you've been to the dentist, right? It's been a
That's
few
right.
years. Okay.
Hmm.
And sometimes, and you're not alone in this, a lot of patients they've had a bad experience. Was that the case with you?
Yes, I do have bad experiences in the past.
Are you okay to expand on that just for a little bit? And if you don't want to, that's okay too.
Well, I really have this fear of visiting the dentist. I don't like feeling any type of pain in my body, especially my mouth. So it really took a lot of guts for me to come here today, and I was hoping I could get the right treatment and the most painless way possible.
Well, I have to congratulate you for having the courage to,
Thank you.
yeah. That's the first step. Is taking the step. So now more than ever, I'm committed to helping make this happen for you. And to address your concern about pain, that is actually our area of expertise. Um, we have patients all the time that because they had a bad experience and extraction was done, maybe they weren't sedated, but we offer different options, different sedation options that will help you to be comfortable. So I want to put your mind to rest about that. Okay.
Aw, thank you. I appreciate that. Would it be possible to know about how much this treatment might cost? Because the doctor didn't mention anything about it earlier.
Yes, we're going to get to that. Let's start first with talking about what we need to have done.
Okay.
Um, your upper teeth and lower teeth. Your lower teeth are actually in better shape than your upper.
Okay, I see.
Okay. Does that make sense? That sound about right to you? that you don't?
Yeah.
Okay.
Mm-hmm.
Your upper teeth, we got a little bit of work to do, but nothing that scares us because this is what we do,
Okay.
right? So with your lowers, when you come back for your next appointment, we're going to make sure we do a deep cleaning on those. Okay.
Okay.
You've
Got
actually
that.
been doing a really fantastic job taking care of the lower. On the upper, we've got several teeth that need to be extracted. They need to come out.
Oh, I see. Mm-hmm. Will that be painful? On a scale from 1 to 10?
Yeah, that's a good question. I knew you were going to ask me that. And so here's the thing, you're not going to feel anything from the procedure. Okay. The doctor has recommended that we first talk about doing nitrous, which is laughing gas. It just kind of relaxes you a little bit, very equivalent to like having a couple of glasses of wine.
Okay.
Do you like wine?
Yeah, I do drink wine, so that seems like a good idea.
All right, so we're going to make sure you're very comfortable with that so that by the time we prepare to take the extractions out, you're going to be in a good place. You're going to be in a happy place. And because we know that the fear is of concern for you, we're going to actually take baby steps, right? We've got several extractions. So when you come back at the next visit, if we need to do this in stages, so you're not worried, we can address maybe this side first, take those two teeth out.
Mm-hmm.
We're going to pause and say, hey, are you good? You want to keep going? And if you're like, you know what? No, I just want to do this side, then we can have you come back and do the other.
Okay, that sounds great. I'm glad you're giving me that option. Would you know how long the procedure is gonna take?
Yeah. So and I believe that when you come that day, you'll probably feel so comfortable that you're going to say, okay, let's go ahead and do the extractions. We're talking 30 minutes, if that.
Oh, okay.
It's going to be very quick. And we're going to talk you through this. Okay. And then we're just going to follow your lead. If you want to continue, some patients, they feel so good, they want to do it all.
Okay. So
All right.
that sounds good. I might be able to schedule another visit, but would it be possible to know how much it might cost me?
Yes, ma'am.
Yeah. Could
Let's
I
get
do it by tooth, or do I have to pay for the whole procedure?
Yeah. So here's what the doctor is recommending. You need to get it all done. You got to get all 4 extractions done. And you've lost some bone where those teeth are. And it's just because it's been a long time. That's why like there's a sense of urgency
I
safety
see.
wise for us to do this. However, if we got to break this up, he's recommending we take care of the right side first. Okay, take those teeth out, get you healthy. Okay, clean out any infection. That'll be
Mhm.
done that day. And then if we need to do a little bit of bone grafting, do you remember him talking about grafting that helps to rebuild?
Yes, but I didn't quite get that. Yes, I
Yes,
do.
ma'am. So it's actually a very easy procedure. You won't even know that it's happening. But when you have teeth that are left for a long period of time, sometimes that bone starts to reabsorb. Okay, the good news is he can place some material. You won't feel it after the procedure. You won't even know it's there.
Okay.
Place, and this is all included in the 30 minutes. Place some
Mm-hmm.
bone graft material, and then we wait because that bone graft material will help to regrow the bone that you've
Oh, I
lost.
see. Okay. Okay, got
And
that.
then we'll bring you back in about 3 months to place the implants at that time. So we're actually going to break this up into 2 procedures. Okay. Questions about that so far that I'm going to talk to you about the investment. Questions about that though.
Oh, okay. How is the Am I allowed to choose the implants? How does it work? I have no idea, no clue on how the implants are gonna look like.
Yep, you don't need to worry about that. That's our doctor's responsibility. He will make sure that he has the proper implants, the proper size.
The
That
colors.
Yeah, yes,
Mm-hmm.
and you don't need to worry about that. When it comes time to putting the tooth on, we're going to make sure that the color is perfect. In fact, because these are the upper teeth, we actually want to give you a makeover all at the same time so we can whiten these.
Oh, that sounds good. Okay.
Yeah.
Will I be able to chew normally after I get the implants?
Yes. We want you to be a little bit careful. We do want you to be a little bit careful. So crunchy foods, candy, biting down into things, we don't want that. So when we'll talk to you about that. Eating normal, you're not going to want to bite down into hard candy or things of that nature. And if you want to do this in stages, quite honestly, you'll be able to chew on the left. And then when you come back and you do the right, you'll be able to, you know what I mean? So don't worry about that. We're going to give you instructions on how to care for them as you're healing. Sound good?
Oh, okay. That sounds really good. All right. So,
All right. So let me
I
tell you
asked.
how much it is.
Mm.
Don't worry, honey. Don't worry. Okay.
All right. So I mentioned this question earlier. Would it be possible to know about the cost, like the full cost? I just want to know the full cost before I make a decision. It might be expensive, and I have to see if I could afford it.
Yes. Well, this is an investment and it is surgery. Okay. So it's not going to be inexpensive. However, don't worry about how we're going to figure out. I'm going to walk you through that. We've got creative ways. So I got you. Okay. To do all four of the implants that you need, the investment is 20,000. And that's all inclusive. So that covers everything. So that's going to cover your sedation, your extractions, the implants, the crowns, all of your appointments.
Oh, I see. It's quite expensive. I think I'm gonna have to go think about it. I might have to ask help from my mom because it's such a big amount. Would it be okay if I go home and think about it first?
So I'm just going to ask you a question. I love that mom is going to help you.
Mm-hmm.
Does mom know the condition of your teeth? Is that something you've spoken to her about?
Well, she does know I'm experiencing a bit of discomfort, but I'm gonna have to. I'm sorry, Shireen. I just have to.
No, no, no. It's okay. It's okay.
Yeah,
Stay in character, honey. These things happen.
yeah.
Don't worry. Don't worry. We're going to pretend this is a part of the role play.
Yeah. All right. So yeah. So that was actually my mom calling me. She's about to
Hey,
pick me
hey,
up.
look.
Yeah.
So listen, if that was a part of the role play and you were like,
Yeah, it definitely was. All
that's my
right.
mom,
So
I'd be like, hey, go ahead and answer that. Let's put mom on speaker.
yeah,
Okay.
yeah.
Right?
Okay. I'll be like, hey mom, I'm at the dentist and they're telling me that I need to spend 20K on my case. So I'm gonna talk to you later about
Actually, hold
that.
on 1 second. Hold on 1 second, Vanna.
Okay.
Can you go ahead and put mom on speaker real quick?
Okay.
I just want to say
All
hello
right.
to her.
All right. So mom, I'm with Shireen and she's helping me out right now. She's from the dental clinic. So maybe you want to talk to her about my case. All right. So let's say she's on speaker now.
Okay. What's mom's name?
All right, she's saying, "What, 20,000?"
What's mom's name?
My mom's name is let's say my mom's name is Susan.
Okay. Miss Susan, this is Shireen from Brown Dentistry. How are you doing today, ma'am?
Okay, let's say she's saying, "I'm doing
So much.
good."
Yeah, you're doing good.
Okay.
All right. Hey, you did a good job with your daughter, but I suppose you already know that, don't you? She's a doll. And I want to take just a few moments. I don't want you to panic because I know that Vanna just shared with you how much this is going to cost, but I want to take a few moments to just explain what she has to have done because she's waited quite some time. And this is an emergency. I'm not trying to scare you, but we do need to make sure we keep her healthy. Okay. Mom,
Okay, she says, "All right." She's
okay,
listening.
mom. Okay. So we've got some work to do that can be done in stages. And Vanna just mentioned that you are going to help her. Is that correct?
Yes, that's right.
Okay. All right. Here's what I recommend that we do because we're committed to helping your daughter and she needs to do this. Um, I would like to, are you local in the area? How close do you live by with to Vanna?
Let's say she's 30 minutes away.
Okay. All right. Vanna has to have quite a bit of work done. And instead of me trying to explain everything over the phone, here's what I recommend that we do. Here's what I recommend that we do. I'm coming out of role play. Write that down, whoever, right? If you lead with that. Here's what I recommend that we do. I would like to schedule a second consultation where you are here and present with Vanna, so you can not only meet with the doctor, we can show you the x-rays, talk to you about how we need to do this, and then collectively come up with a plan of action so that we can make this financially comfortable for you so we can actually get this done. How does that sound to you?
Okay, she agrees to that.
Okay. Tomorrow, we have an opening at either 10 or 1 p.m. What time works best?
She'll take 1 p.m.
1 p.m. And I would say plan to be here about, I would say, up to 2 hours. Do you have anything to do after that?
Oh, she's free. She's a housewife. Okay.
Okay, all right, perfect. I would plan to be here for about 2 hours because we could actually, once we figure out the financial aspect and so forth, then we'll go ahead and make sure she could kind of transition right into the exam to start preparing. Okay. How does that sound to you?
Sounds good. And she'll see you tomorrow.
Okay.
We'll see you tomorrow, I mean.
Yep. And when Vanna leaves here, she'll give you my cell phone number. So if you have any questions tonight that are super pressing that just can't wait, you can text me. I keep my phone on until about 8 p.m. Okay?
Okay. She appreciates that, and she'll see you tomorrow.
All right. Thank you, Mom.
Okay.
All right.
That was good.
And then at this point, Vanna, I would give you an appointment card. Here's your appointment card. I don't want you to be stressed out about the investment. I don't want you to be stressed about keeping you comfortable, because that's what we do. How are you feeling about it? How are you feeling?
I'm feeling much better compared to, the first time I walked in here. I feel much reassured, and yeah, I guess I'll have to wait till tomorrow and see what my mom decides.
All right. Now, take your phone back out, if that's okay. I want you to program my name and cell phone number right now in your phone. Okay.
Right.
I'm going to go ahead and text you. Do you see my number?
Yes, I do.
Please save it as a contact.
All right, it's saved.
All right. I'll see you tomorrow.
All right, I'll see you tomorrow. Thank you so much. You have a good day too.
Okay. Now, you see how life happens. Now, somebody next door decided they wanted to mow their grass, but we're going to move past that. And I wanted to be outside. If Jackie, if you're on, I'd love to hear your thoughts and comments. Vanna, how did that feel to you, truthfully, as the patient?
Well, it felt like a regular conversation. It's not the usual medical conversation with like a really professional doctor or dentist. Like, I feel much more reassured. The conversation was really light. And, I know some doctors, they would just talk about the procedure and how much it costs and how long it'll take me to recover and stuff like that. But I love how you inserted, those casual little conversations in there. Yeah. I feel like I'd definitely not be scared after talking to you anymore.
And I had to, did you notice that I knew you were concerned about the money, and I knew that you were concerned about the pain. And what a lot of treatment coordinators would do is they would go into the money, but I had to table that for just a second.
Yeah, I noticed that you didn't answer my question about the amount right away. And it made me feel like, okay, this girl isn't trying to get my money. She's actually trying to make me feel safe first before we talk about that. Yeah.
I had to build rapport. I had to get trust very quickly, but I didn't want to dismiss what was ultimately most important to you. And I love the phone call, right?
Yeah.
Perfect is that, because these things happen, but that is a blind spot. Mm-hmm. Like a lot of people would say, oh, go ahead and get that. And they're like, that's my mother. And they wouldn't even maximize on the opportunity to be like, let's get on conference. Like, this is perfect.
Yeah.
And let's get mom in the office. I'm not even gonna go through the money and the logistics with mom at that moment.
Yeah.
We're gonna do that in person, and we're gonna plan for 2 hours.
Mm-hmm.
May not take that long, but the goal is when you and mom come back tomorrow, that mom is gonna be like, okay, I feel comfortable. They've explained it. My daughter's got infection, so we got to get these teeth out. What could y'all do today? Start it today? Oh yeah. All right. That's it in a nutshell. Vanna, thank you for doing that with me.
Thank you, Shuri. Thank you so much for having me here as well.
Yep, you got it. And so, guys, if this was like a blind spot, right? If you're like, man, I don't know if my treatment coordinator can do this, but you want to get skill sets up to that point so that you have a treatment coordinator that can roll with resistance. And if you want to change what cold case presenting looks like, that is what I do. That is what I'm most passionate about. And so you can, and I offer a complimentary discovery call. You would just go to my website, which is www.realtalkselling.com. And I'm crazy. I give my cell phone number out. I text doctors all day long. You can also text me as well. And that's on my LinkedIn page. But I hope that this was valuable to you. Comment, like when this goes through my feed if you have any questions. And I'm going to do this once a week, every Wednesday at 12. Sometimes it'll be that I just want to role play. Sometimes it'll be I might have a guest on. But this is what I do. And I love it. Thank you guys for watching. Have a blessed day. Talk to you soon.